Hello, my name is Anita Luanga. I'm a physician. I specialize in internal medicine and geriatric medicine. I help my patients stay healthy and out of the hospital by optimizing their diet, their exercise, their sleep, and their medications. In this video, I'm going to talk about some reasons why your blood pressure might be different at home compared to when you go to see your doctor or when you are in a healthcare setting. The first reason is that you might have something called white coat hypertension. So white coat hypertension occurs when your blood pressure is normal at home, and then when you're in the healthcare setting, your blood pressure is a little bit higher than normal. A second reason why you might have different blood pressure at home is if you have masked hypertension. Masked hypertension occurs when your blood pressure is high at home or in a setting where you're more comfortable, and then it's normal or lower in the healthcare setting or when you go to see your doctor. The third reason why you might have different readings in your blood pressure when you go to see your doctor is that your machine might not be very good, or the machine that your doctor is using might not be very good. For example, a lot of people are buying these blood pressure machines that check their blood pressure on the wrist. The traditional and probably better way to do the blood pressure would be to have a blood pressure cuff and to have your doctor actually auscultate or listen to your blood pressure as your blood pressure is going down. There are a lot of newer machines that can do this in place of the doctor, primarily because doctors tend to have some of their staff members do this, and if they are not as well trained in doing this, they might have the wrong reading. If the blood pressure machine at your doctor's office or the cuff is perhaps too small or too large for you, the reading might not also be good. So what should you do about this if you're in this situation and you suspect there's a big difference in your blood pressure when you're in a more relaxed environment versus when you see your doctor or you're in the healthcare setting? You should probably talk to your doctor about this. I usually ask a lot of my patients when we see a big difference in their blood pressure to write their blood pressure down, try to keep the time consistent, and then we compare the readings at home versus the readings when they come to the healthcare setting. I've even had many astute patients bring their machines in, and then we compare their readings as soon as I do their blood pressure or my assistant does the blood pressure, and then they bring out their machine and we compare the blood pressure readings. If there's still some confusion or some discrepancies, there's some things that your doctor might do, such as ordering a test called an ambulatory blood pressure monitor, which looks at your blood pressure over a 24-hour period. I hope you found that useful and informative. Bye-bye for now.